tracking the COVID-19 vaccine, as more than a third of United States adults become fully vaccinated against COVID.
Yeah, the CDC says nearly 216 million doses of it have been administered across the country, and about 41% of Americans have received at least one dose. But here in Arizona, it seems like things are slowing down. The CDC says Arizona's vaccination rate has dropped drastically. We went from 28th to 33rd in the country in just a matter of weeks. State health officials say a big reason for the slowdown, people are afraid of potential side effects. Another issue, transportation to the big vaccination sites like over at State Farm Stadium. Community leaders are organizing pop-up events to try to reach more people.
So the large pods, they work for a greater number of people, but not for the folks that have been hit hard in diverse underserved communities. And so it's a meet me where I am approach, bringing the vaccine into their neighborhood so it makes it easy and accessible.
The whole J&J thing certainly can't be helping much. A few weeks ago, a lot of people had trouble even getting an appointment on the state's website. This week, there's about 30,000 appointments available right now.
Pretty soon, there'll be even more appointments available here in the Valley.
Yeah, that's because the state opening up a new vaccine site, this one closer to people in the North Valley. So that's where Gibby is this morning ahead of the first shots being given out. Gibby.
Yeah, good morning, guys. As you mentioned, there'll be about 4,600 shots available here, appointments available here at this site. But you think of Gila River opening up tomorrow, then this weekend, South Mountain Community College. So there will be sites and places ready for people to get vaccinated if they so choose to. As a matter of fact, we are going to reach a milestone here, about 2 million. And joining me here is Dr. Cara Christ with the 2 million mark coming right around the corner. But Scott just mentioned that our pace seems to be slowing here in Arizona. Why is that, and what are some of the things we could do about it?
So Arizona did a great job at the beginning of really opening up capacity and getting vaccinated. What we are seeing is a slowing in the demand. And so people who were that low-hanging fruit, like I'm going to get it no matter what I have to do, have already gotten it. They've had that opportunity. And so now what we're going to be doing is reaching out to those communities where it's a little bit harder to get vaccinated.
Now, right before they came out to us, they had a story about these undermanned communities that really don't have places to get to, or people can't get to it by car. But you have set up locations across the state here. You mentioned this one opened up here in Scottsdale, even though we see that there are other places like down south. Is there a method to this madness of where you put up these pods?
There is. So we have been working with Maricopa County and the partners. Each one of the indoor pods represents one of the major pods that was up at the beginning of the event. And so what we're trying to do is get state pods around where it's also convenient, but then you'll see pop-up events inside the communities where it's closer to some of those communities and they don't need transportation.
We're talking about schools. We already saw Queen Creek, J.O. Combs over in an area where it seems like there's still a high area of transmission up there. What are your thoughts about that with them taking away the mask mandates in schools starting today?
So we removed the mandate, but not the recommendation. CDC and the Department of Health Services recommend that there is universal and correct mask use at the schools. What we were identifying was that there wasn't really an enforcement mechanism to enforce the mandate, but schools should still have a policy for those COVID-19 mitigation strategies.
Yeah, along those lines, because we know they're just going on what the governor set out. And were you on board, and did you agree with that, with the removing of the mandates as well?
You know, as we've been watching the data, we've been taking a look at what we can do. So several weeks ago, you know, we removed the mandates from restaurants, gyms, bars, nightclubs. They can now go back as long as, you know, they do what they feel is necessary in their business. We then looked at the schools, and some of the schools have really great mitigation strategies and could determine policies for their own.
You know, when I look at the sign behind you, it says every shot gets us closer to a community of immunity. Is that the importance here? Because you're trying to get everyone to get vaccinated who can, and now the numbers are there. You have enough to get those people who want to get the shot.
Yes, we have capacity. You're almost going to be able to find a same-day appointment almost anywhere at any of the state pods. So we are recommending that everyone get vaccinated, because while vaccine protects you, it also protects those in the community. The more people we have immunized, the safer we'll be.
One last question really quick. I know folks are scared. I don't know if it's social media, the misinformation. What's the best thing they can do to get informed so that they feel comfortable getting this shot?
What we would recommend is going to azdhs.gov. We have a whole website about the safety of vaccine, frequently asked questions, talk to your healthcare provider. But we've got almost 2 million Arizonans fully vaccinated today. I think we hit 2 million, and very, very few adverse side effects.
Dr. Cara Christ, thank you so much for joining us here this morning. And guys, the reason why I brought up that last question is that I think that is one of the biggest things we hear from those who are hesitant about getting the vaccination is all this information that they're getting. And a lot of times it's from both sides and it's leaving them confused. But the idea here is that the state are doing their part in setting up these vaccination sites for you to be able to set up an appointment if you so choose to.
Right. Yeah, it almost seems like you can get different information from almost every single person you talk to.